Have you heard of direct primary care? A group of local doctors is now offering it as an alternative to traditional health insurance.
Chris Hoffman examines what makes a difference so you can decide if it's right for you.
So if you want to come over and have a seat on the exam table.
In an office about the size of a studio apartment, Leslie Benedetto is forging a stronger bond with her doctor.
Zumba, walk.
For years, she was going to doctor's appointments all over the area to help her 3 children who battle several medical conditions. Trips to the doctors were not always easy.
Especially with autism and whatnot, that creates a lot of anxiety.
And she says doctors didn't always handle her children's needs delicately.
You're not quite sure who you're going to be seeing that day.
So last July, she and her family started visiting Dr. Natalie Gentili's practice in Highland Park.
I knew this is what we've been looking for my family.
Dr. Gentili is part of the Direct Primary Care Physicians of Pittsburgh. They operate on a subscription basis, meaning patients pay a monthly fee and get full access to her, whether that's a late-night call or text or a next-day appointment.
In the traditional model of primary care, that's not well supported.
She says that's because traditional health care is basically just sick care.
We are only really going to see somebody when we have a problem that needs to be addressed acutely.
Under DPC, she and her fellow doctors try to create stronger patient-doctor relationships.
I think now more than ever, having that physician that you can easily access and run things by is very important.
To achieve this level of care, each practice has a set limit of patients, usually about 300. Most memberships for an individual are less than $100 a month. But since this is outside of your traditional health insurance, DPC doctors recommend you keep at least catastrophic coverage for emergencies.
If I have this primary care physician and I end up needing to go to hospital, pay 100 or 200,000 or more, at least I have something that I don't go bankrupt.
Dr. Ahmed Khani Jahani is an associate professor of health policy at Duquesne University. He says this type of health care is best suited for people with chronic health issues who need to see a doctor more often.
As a healthy person, you might not need to go to doctor every other week or month. You might need to have once or twice checkups a year.
He agrees a stronger connection with your doctor is beneficial, but he says making the switch also has to make sense financially. And perhaps where direct primary care makes the most sense is for small business owners. Take Don Mahaney. Under traditional health benefits he provided for his 9 employees, only 3 had doctor visits in a span of 5 years.
It wasn't working for us. It was inordinately expensive.
So this spring he switched over to Dr. Gentili's practice. His business now covers doctor visits for employees, while they all contribute to a health share plan for emergencies. He says it's actually saving the business about $500 a month.
Any small business owner really needs to be paying attention to the overall wellness of their staff. You can't run your business without your staff. They're just utterly essential.
As for Leslie, her children are now more comfortable with their doctor and comfortable speaking with her, which means she can now take care of herself.
I spent a lot of time at doctors, but it wasn't for my own care. So it's given me the ability to do that.
Leslie and Dawn both say direct primary care is a win-win for them. Chris Hoffman, KDKA News.